people in Washington are more afraid of their constituents and their voters than they are of the interest groups that control Washington, then this country is going to start moving in the right direction. I know most of you are here to just talk a little bit about health care. And the debate that's going on nationally and in Washington is that the federal government cannot run anything well, and we can't turn health care on. What the president is for, and I don't have to guess because it's in legislation in the House, and the promises he's been making is not in the legislation. But I was a businessman before I went to Congress. I had to buy insurance. I had to buy insurance on the open market for myself when I started and then for 20 people. When my children aged out of my policy, I had to buy policies for them while they were still in college. Some of them had pre-existing conditions. It was hard to do. The system is not perfect, and I don't have any affinity for insurance companies. They need to be forced to compete. Now, the president is talking about the need for competition, but when I brought up the bill to allow interstate competition of insurance, he voted against it, and so did every Democrat. We're talking about being fair to people who don't get their health insurance at work, but when I put a bill on the floor of the Senate that would at least allow people to deduct the cost of a health insurance premium if they had to buy it themselves, he voted against it, and so did every Democrat in the Senate. I had a bill that would allow people to use their own money in their health savings account to pay for an insurance premium. Common sense. He voted against it, and so did the Democrats. So, folks, there's no doubt in my mind that the folks who are proposing this government takeover do not want private health insurance in the hands of every American. What they want government control of health care. And so the debate here is not between those who don't want any changes and those who want government. It's between those who want to make the system work better and those who want government control of our health care. The plan that's being proposed by the president, whether you call it a public option, whether you call it co-ops, this is government control of health care. It's cash for clunkers. It's Amtrak. It's for Katrina cleanup. It's not what we want for our health care system. We can change it. I want to hear from you. And they've been trying to kill Medicare Advantage for several years because it gives seniors a choice, and it keeps private health insurance as one of the choices. My hope one day is if you have insurance when you retire, that Medicare will help you pay for that policy and you keep it. It would save the government money, and it would allow people to keep their own private health insurance. But if you read the bill, they say you won't lose your coverage. There won't be Medicare Advantage in the future. Hundreds of millions of people will likely lose their insurance at work. They're talking about cutting $500 billion from Medicare, which is already underfunded. We don't need to be cutting from Medicare. If there's fraud in Medicare, we need to find it and put the money back into Medicare so that we can have better coverage, not worse. Seth. The president has, attacked me, attacked doctors, and before they left, they decided the best thing they could do during the break is to vilify insurance companies. You know, I'll join in that insurance companies got a lot of improving to do. If we made them compete, and if there were hundreds of policies we could all choose from, you would see them sharpening their pencils. But you're right, we're not going to fix this by vilifying doctors and hospitals and insurance companies. They've called all of you folks mobs, that your anger is manufactured, and we know that's not true. So you're right. Let's fix what's broken. We're not going to fix it by vilifying insurance companies. Okay.
I feel like so much of this debate has gotten stuck on the minutia, a public option or reimbursement for end-of-life consultations, death panels, stuff like that. But just taking a step back at the bigger picture of what you were talking about earlier about competition being in the private sector, would you, as you said, you would like to expand it just outside of the state for insurance companies so we can get better competition and stuff? Would you be in favor of some kind of, whether it was regional or even national, the government having almost like a chamber of commerce that if an insurance company wants to sell insurance in a region or in the country, they have to be a part of this Chamber of Commerce, and by having this Chamber of Commerce, we can set the rules on the insurance companies that say, all right, you can't deny for pre-existing condition. You know, you have to cover everyone and stuff like that. It's actually, and that would, that actually would bring competition. And it sounds like that's exactly what you're looking for. Is that something you would be in favor of?
We don't need the government to set up the regional. I work in the private sector. I work with most of the companies, and if everybody is empowered to buy health insurance, and those who can't afford it, we make sure they have a health insurance voucher to do it, and we allow insurance companies all over the country to compete for their business, you're going to see insurance companies competing for our business. But there are people with pre-existing conditions that the natural market is not going to want to deal with, who are going to charge too much. The plan I introduced has $25 billion in block grants to states to make sure they set up good, low-cost, high-risk pools for people with pre-existing conditions. Because if we don't do that, then we're going to have to mandate that every insurance company take a guaranteed issue to everyone, regardless of their health. And what we've seen in other states happen is that people wait until they're sick before they buy insurance. And then you don't have people participating in the market. So let's let the market work. And for those who have pre-existing or high-risk conditions, and I've got them in my family, so I want them taken care of. But we can do it in a different way without all these mandates and fanny meds, as they're talking about, is having the government-sponsored entities being a kind of a clearinghouse for policies. But our goals are the same. Everyone needs to have access to affordable health insurance policies. So, well, I tell you, okay, why haven't you the tort system, which is frivolous lawsuits, lawsuit abuse in health care? I heard that the president of the Spartanburg Regional here said as much as a third of the costs that they deal with in the hospital are related to lawsuit abuse. And now some of the plaintiff's attorneys will say it's only 2%, but if you talk to doctors and all the defensive medicine and everything that goes on in a hospital, it is very expensive. And the fact that the president and the Democrats have written a bill that's over 1,000 pages and called it health care reform, and it does not have one bit of tort reform in it, tells you who's writing these bills. And it's not the lower cost. This is special interests driving this thing. And you're right, you're not going to fix health care without some reform of lawsuit abuse. My bill does that. But there are 3 or 4 things that we can do to make our system work a whole lot better. We need to try those before we give up on freedom.